Keynote-204 was a randomized trial comparing pembrolizumab with brentuximab vedotin in patients with relapsed or refractory classical Hodgkin's lymphoma. And these patients had to have relapsed post-transplant or be ineligible for stem cell transplant. The primary results looked at progression-free survival from the time of randomization, and the primary endpoint was positive for pembrolizumab, where there was a statistically significant improvement in progression-free survival for the patients that received pembro compared to the patients that received brentuximab vedotin. As part of the clinical trial, patient-reported quality of life was formally assessed at baseline and at multiple time points. And the take-home in terms of the summary of the results with regards to quality of life was that in comparison to brentuximab vedotin, the patients that received pembrolizumab had a more favorable impact on their quality of life, were more likely to have resolution of B symptoms or a delay in time to development of B symptoms that was typically associated with disease progression, and also had some more improvement in terms of their health-related quality of life compared to the patients receiving brentuximab. I think it's really important for clinicians to have quality of life data available when comparing the role of two different treatments that are both available for patients. We know that efficacy in terms of disease control is an important endpoint, obviously, and in this trial, the result was quite clear, showing the improvement in progression-free survival for pembrolizumab. But importantly, the health-related quality of life data was similar and also favored pembrolizumab. So for the clinician, it makes for an easier choice in that the arm that did better in terms of disease control also was more favorable.